Good morning. I'm Stephen Williams, Director of the Houston Health Department. I want to welcome you to our COVID-19 talk with our local health authorities, Dr. David Persse, representing the City of Houston, and Dr. Umair Shah, representing Harris County. I want to thank the Rotary Club of Houston and President Kathy Finninger for sponsoring these talks, which have been going on for about 8-9 weeks now. Let's just jump right into it. Hot off the press, I got it from President Finninger. CDC just put out a bulletin regarding COVID-19 and surfaces.
Yeah, so what they've done is they've changed the verbiage in their description of how well the COVID-19, the SARS-CoV-2 virus spreads from surfaces. And it's it's just a word change, but it's not subtle. What I think that they're doing, and I've looked at it and I've tried to find where they made the change from, and I've not been able to, but what I think that they're saying is that not that it doesn't spread from surfaces, because we know the viruses spread from surfaces. If I cough or sneeze and grab a doorknob, somebody else grabs a doorknob and then wipes their eye, they're going to get infected. I mean, it's just going to happen. What I think that they're saying is that this virus spreads so easily from person-to-person contact, just by conversation, especially if you don't have a mask and if you're too close, that is causing way more spread of the virus than what usually does. And so I suspect that the surface spread is probably not less. What I think they're trying to stress is that the spread from person to person is so much greater.
Okay.
Yeah, I mean, I think that what I would say is that we always say that, you know, keep your eyes on the most likely course of spread, which is this human to human, not necessarily the surface, but we know that does have the ability to transmit from those surfaces. So it's really making sure to focus on what we can do very, very closely. But I would still recommend people, you know, are careful with doorknobs and things of that nature as well, especially with the hand sanitizers or washing their hands.
I think one of the things that has been confusing to folks are these studies that say that the virus can live on surfaces for, you know, 17 hours, 3 days, whatever, these really long periods of time. And that frustrates me, because you may be able to detect the virus on a surface for a long period of time. That doesn't mean that the virus was in a condition where it could infect somebody.
That's right.
Or that there was sufficient amounts. So you got to be a little bit careful with that. And I get frustrated when I read those articles, because that doesn't mean it's necessarily infectious. But I think common sense tells you, if somebody coughs or sneezes and grabs something and then you go and touch yourself, bada bing, you got it.
Yeah.
Okay, another one that I got on text. After coronavirus, office workers might face unexpected health threats. Stagnant plumbing systems and empty commercial buildings could put returning employees at risk of Legionnaires and other illnesses. And we've had that before.
Yeah, no, I think that the issue is secondary impact, and we talk a lot about secondary impact of people who do not seek health care in the midst of all the different decisions that have been made across the country. So we do know that includes, you know, not going to the hospital for a heart attack or chest pain or other kinds of care for their conditions. But I think it also applies to establishments making sure that as they reopen, that they're also taking into consideration all the different systems that go into place in order to be able to protect not just their customers, but also the workers that work there. And so both of those have to really be attended to as we reopen. That's why we want to make sure reopening isn't just about the business, it's also about the health and safety protocols.
Right. So when the reopening first sort of started, we from the Houston Health Department at a press conference with the mayor advised all the food service owners to make sure that they had flushed they had let all the faucets run for several minutes to flush the water out. And also, one thing that's forgotten is that you've got to make and discard ice at least 3 cycles to make sure that you flush out those systems as well. And then of course you got to clean everything and so on and so forth. So yeah, there's some things that people can do to increase the safety.
If you're required to take a long-distance trip across the country, would traveling by auto or plane be safer? And I'm going to listen closely because my wife is traveling next week.
So, you know, the statistics have always been that traveling by plane is safer than long distance in cars when you look at the mortality rate, the death rate. But I think that the risk is different now. So if I had to travel someplace far, I'd drive.
Yeah, I would too. I guess it depends on how much time you have and how long the trip is, right? So if you've got to go from here to Boston, that might be and you only have a day to get there, that's a different situation. But if you're trying to just get to, let's say, somewhere in Alabama, and you've got a day, you can make it by drive. So I think that there are going to be some real considerations people are going to put in there. But Stephen, to your wife, depending on where she's going, I would say if she can drive, I think that would be best.
She just needs to plan enough time so she can take breaks.
That's right.
Get a cup of coffee or a Coca-Cola or something with a little caffeine, but not drive tired. That's the mistake. People drive tired.
Well, and the other thing, and I think it's important to point out, David, is that as you're driving, because each state and community has a different reopening strategy and different protocols in place, different, sort of rules, if you will, that your wife or in general anybody that's driving, if they're going to other communities, they need to actually be very mindful of what's required or what's expected in those communities from a COVID-19 standpoint. I mean, I think that's something we need to really be also mindful of, because it may be different in New Mexico than Texas, or maybe different in Louisiana than here in Houston.
It's 24 hours driving.
It's a long drive.
Is there anything?
Oh, so where's she? So
Is there? Moving on. Is there any indication that there is tissue or lung damage after recovering from COVID?
There are some studies that show that there is lung damage. Yeah, I haven't seen it to the level of saying that every person who has COVID-19 that has lung findings has lung damage that's long-lasting.
Right.
But again, this is the kind of information that continues to evolve with additional science.
Yeah, I would agree. There is evidence of some lung damage. The question is, how long does that damage last? A lot of our tissues are very resilient and can heal themselves, and that's what we got to find out.
Yeah.
Okay, 5 sailors on the USS Theodore Roosevelt were infected for the second time. They had previously tested negative twice before returning to the ship. Is this testing inaccuracy or proof that you are not immune or to reinfection?
Yeah, I think that's a great question.
Yeah, it could be both, but I think it's likely that it's a reinfection. I mean, is that kind of how you're? I mean, let's assume that the testing is fine and there's a retest positive. At that point, then the assumption is that it's a reinfection. But
I think we need to wait for the Navy to finish their investigation on this, because I know there's one going on to get out to us, because certainly on the Roosevelt, they have now done everything they can to make that a safe environment, and the sailors are back on there. And so for these 5 individuals to now test again positive, so was that a reactivation from within themselves, or did they get infected? Were they completely virus-free? And at this point, this virus is breaking every rule.
Yeah.
So I don't know.
Yeah. Are they virus-free, and then there was no more virus on the ship, and then they get reinfected? So then the question is it them? Is it the ship? Is it something else? Yeah.
Right. Don't know.
Yeah.
Well, actually, I don't know has been the answer to a number of questions related to COVID-19. You have been watching our COVID-19 talk with our 2 local health authorities. We'll be right back.
Talk about yourself. Talk about yourself.
So where exactly
so
is she
you-
going?
Wash your hands. Scrub them while you sing the song. Wash. Rub your hands and fingers in the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1.
Taking care of yourself is also taking care of others. We are all in this together.
To our COVID-19 talk. Actually, this is our 10th week of actually engaging in this COVID-19 talk with our 2 health authorities. Of course, I didn't remember that, but President Kathy Finninger reminded me of that through text. Have you heard about cell therapy for those experiencing ARDS, acute respiratory distress syndrome?
I have not.
I have not.
Well, the answer to that is no. In your opinion, if you could only use one key indicator to determine how we're doing, what would you use?
Well, the thing that pops in my mind first is death rate, because this is all about
That's
saving
what I was
lives.
gonna say,
So I would have to go with that.
That's what I would say as well.
Death rates? What would the second one be?
Hospitalization.
Yeah, something healthcare related.
Yeah.
Hospitalizations would be the likely one.
And of course, we're medical people, so we're going to have that
Right,
bias.
right.
But their thought is that's probably right now the most accurate number.
That's right,
versus,
because
say,
everything
testing.
else in the community is bouncing up and down, or there's delays, or there's artificiality to it. But the number of people that are going to hospital is somehow constant or somehow related, and obviously ICU admissions and then deaths. So the deaths really is the one. And as a community, as a county, we've done fairly well from a county standpoint when it comes to deaths. Now, we always say this, that any death is both unfortunate and also too many. But if you look at it, we've had 200 deaths by and large in our community, and LA County, I think just a couple of, maybe about 5-7 days ago, had exceeded about 1,500 deaths at that time, and I think was nearing 2,000 deaths.
Yeah.
So from that standpoint, we've done well, but again, there's no honor in this one. I mean, we're still in this. We're still in the middle of this.
Right.
So we're really trying to figure out how to continue to keep it in that way, especially as we reopen.
Right. I agree.
Prior to permitting students to return to school in the fall, do you recommend requiring proof of negative testing?
So I had a long conversation yesterday with someone about schools, and schools are going to be a real problem because the testing that's available today, other than the PCR test, when there's still generally about a 2-day delay on that, that's our most accurate test. And I know a lot of people are looking for antibody testing, and we don't, so the reliability of antibody tests, I still find to be in question. But even if you do have antibodies, we don't know that confers immunity. And so I don't know, we have to give some really considerate thought to schools in the fall. That's going to be another huge challenge as to what we do. And I don't think that we can keep schools closed. We need to figure out a way for them to open safely.
Okay.
Yeah, no, I agree.
Harris County recently received an F in social distancing according to the metrics compiled from smartphone location service data from cell phone users and based on average distance travel, change in visitation to non-essential venues, and change in human encounters. How would you tutor the county to pull that grade up? I think we've all talked about that.
Yeah, I think we were doing, obviously, and we know we were doing a lot better when, we were in the stay home, work safe period of time. It's really dependent on all of us. And I think there are two things that, we all know, and I think it's important to underscore, is that one, it's not just about raising awareness, it's about changing behavior. And so I was talking to some of our team members yesterday, and I call it ABC, awareness, behavior change. So it's not just about letting people know it's important, it's about actually getting them to then do something about it. And all the things that we're doing, the facial coverings and making sure that we stay socially distanced, but also not going out when we don't have to. These are all really dependent on people in our community.
I think that we need to get people to start aligning what they want, right? So they want the economy restarted, they want to be able to go visit friends and family, they want to regain their lives the way they were, right? But we need to align that with the new behaviors that people need in order to protect themselves and others. And so, part of it is inspiring people that if you want the economy to get reopened, then you need to wear a mask and you need a social distance. If you want to, visit your grandmother in the nursing home, then you need to know how to do that safely. If you want to do these things, you need to know how to. So I'm kind of hoping that we can align those because this is what people want, and understandably so. But how do we get them to understand that if you want that, then you also have to do this now?
That's right.
Because if you don't, and the numbers take off, then we run the risk of having to pull back on all the things that you want to do.
That's right. Health and safety has to, and this is the other piece of this. I don't know why it's an either or why it can't be an and. That
Yeah.
we can open our economy, we can get back to whatever level of what life is, and yet do it with safety and health in mind as well.
Right.
You can do both. We just it's really dependent on all of us.
Having been a therapist, behavior change is tough.
Yeah, it is.
Some viruses slow in summer months, but COVID does not seem to have decreased in Australia in their warm and humid weather. Are we hearing about any correlations yet?
The only thing that I've seen was that there was one fairly good study that I saw that looked at the impact of temperature on the virus. And we talk about the replication number, the R naught, right, the R number, and that's about how many people one infected person is likely to infect. And so for this virus, it was running in the 2.5 to 3 range. And so when the temperature got high, it dropped it all the way down to 2. So it does have a beneficial impact, but nowhere near enough to have a functional impact. That's the study that I read. I thought that was a pretty well done study.
Yeah, and the only thing I'd add is that the family of coronaviruses tend to have a seasonal variation, but that doesn't mean that COVID-19, because it's a novel virus, that's going to follow that same pattern.
Okay. During 2008 and 2009 swine flu situation, there was no broad lockdowns. That begs the question, how is COVID-19 significantly different than swine flu H1N1? Example is COVID X times more contagious, higher than expected mortality rate?
Well, you know, David and I, and Stephen, you as well, remember 2009, 2010. It was actually those were the 2 years, 2009, 2010, and you know, we were responding as 18 months was our response. That was for a mild pandemic, and I think what H1N1 showed us is that we could very quickly get from, because it was an influenza type of virus, that we could get to vaccine pretty quick. And it was a very big effort from spring to get to fall to actually be able to get a vaccine in place and then move forward. But it turned out to be a mild pandemic. This has not been mild at all, and the vaccine is far away.
Right. I think that the other thing that we recognized was that with the 2009 H1N1, we came to recognize fairly early on that the case fatality rate that we were initially warned about was much higher than it turned out to be. And so the problem with this virus is its case fatality rate seems to be holding
Constant,
at around that 2% level, whereas with H1N1, we found out that it actually was similar to the seasonal flu, which is about 0.1.
That's right.
So 20 times less lethal.
And that's with all the measures that were taken.
Right.
And you know, so it unfettered, what would that have done? And
Right.
that's the other concern.
Right.
Yeah.
Would you tell us about the number of recoveries versus deaths in less than 1 minute?
So you know, I don't put any value in the recovery number. I mean, every recovery that's counted is great, but there's so many recoveries that are not and cannot be counted. So I don't know how to answer that question, because deaths are, you know, a binomial. It's either somebody died or they didn't. The recoveries, many people recover, and it's just not counted. So I don't know how to connect those two.
Yeah, I mean, the only thing I'd say is that it is good news when you hear that somebody has recovered, because we want that to be the norm, and you know, not the exception.
Okay, thank you for tuning in to our COVID-19 talk. We'll be right back in a few minutes.
Talk amongst yourselves.
Okay. So what's going on with you?
We have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
Doesn't mean that we can't be alone together.
How do you protect yourself and others from coronavirus?
Avoid touching your eyes, your nose, and your mouth.
Wash your hands often with soap and water for 20+ seconds.
Clean and disinfect surfaces and objects.
Together, we can help slow the spread.
Respond to the upcoming 2020 Census Survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to our COVID-19 talk with our health directors from the city of Houston and Harris County. It's been reported that there's been an 80% decrease in early skin cancer detection. This suggests that people are staying away from the healthcare system, considering these tests to be non-essential. What should be done? And I think, David, you were talking about, some of the things that y'all are seeing in EMS too.
Yeah, so with the Houston Fire Department, we've seen about a 20% reduction in our EMS call volume. But more to the point, we've also seen a 25 to 30% reduction in the number of calls for people having acute heart attacks and strokes. And so I had a conversation yesterday with one of my colleagues in the medical center who oversees one of the big emergency departments and asked, well, are you seeing patients that are now coming in 2 weeks later that are in congestive heart failure, or that are coming in and their strokes have completely evolved to the point where there's nothing more that can be done about it? And he said something really interesting. When somebody has a heart attack and their heart starts to fail, they're then going to come in a couple weeks later in congestive heart failure with difficulty breathing, and they're all being initially assumed to be COVID patients. And so they're being admitted upstairs with suspicion of COVID. And he said they're going to need to go back now and sort through that data to find out, to answer my question. But we're absolutely seeing a decrease, which suggests people are afraid to get in the healthcare system. And that's unfortunate, because other illnesses continue to go on that you've got to get on them early, especially heart attacks and strokes.
And nationally, there's also been some reports that there have been decrease in vaccination for kids.
That's right.
Non-COVID, obviously COVID, we don't have a vaccine, but other kinds of conditions, measles, mumps, rubella type of vaccinations have seen a decrease as well.
Right. Speaking of kids, pediatric multi-system inflammatory syndrome seems to be positive for antibodies 5 to 6 weeks after exposure. Is that the same with adults?
So the multi-organ inflammatory syndrome at this point appears to be observed only in kids defined as less than 21 at this point. And the other thing is that it is still a rare event. So in New York City, with all the cases, they only wound up with 100 and something kids who were critically ill. And across the nation, there are another 24 or so. I just last night got word that Texas Children's has a couple of cases that they think maybe, and they're trying to sort out. So it's really early, so it's hard to know if that's going to occur in adults, but I'll tell you what, at this point, I wouldn't be the least bit surprised if 2-3 months from now, we're talking about it in adults as well.
And this is something that's come up before, and it has to do, in the past disasters, suicide rates have sometimes dropped as people come together. Is the cure, social distancing, more deadly than the disease? What are the numbers saying about the change in number of suicides compared to the number of COVID deaths? I don't know that you know the specifics, but what?
Yeah, and I think it's too early at this point. We've seen anecdotal reports of things, but we obviously are concerned about the mental health and behavioral health of individuals, the emotional, spiritual health of individuals as well. And I think the thing that you had mentioned just last week was that it's not about social distancing, it's about physical distancing. So we want to be physically apart, but we really do want to be socially or emotionally together. And I think whatever we can do to help with that is really the most important thing. But right now, I think it's too early to get all the, we don't have the data, for example, at Harris County Public Health. I don't know if you guys have some data yet, but it's a concern of all of us.
And I know we both have got a great relationship with the medical examiner's office, and so I'll probably reach out after this question and see if they've seen an increase in suicides. Now, there was a suicide of an emergency physician in New York City that I mentioned, which is tragic, and I think it goes to the point about the stress, because here's a woman who is the director of the emergency department at a big hospital in New York City, and as this thing ramped up, it sort of ramped up around her, and it got worse, and she sort of grew with it, if you will, emotionally. I suspect. I don't know. I never met the woman, but then she became ill and went home, and she was home for about 2 weeks, and then when she went back to work, apparently quite immediately her personality changed. She became very depressed, to the point where her parents took her to their family home in Virginia, and her father described her being very distant, and she wound up taking her own life. And what I suspect happened was that as this thing evolved around her, and all three of us have been in disasters, and it's like after the fact you look back and oh my God, that was horrible. But as it evolves, you're just so caught up in it, you don't have the time to take a step back and see how bad. And I think when she was ill, she was home, she got a break. And then when she went back, she went right back into the deep end. She went right back in the hottest part of the fire. And I worry that was just too much for her. And I worry about other folks and really everybody. This is very troubling to a lot of folks.
Well, and I think the other thing I was going to say is that it's also been very difficult for us because as responders, we've had, I know we've been working 16, 18, 20-hour days, and it's slowed down to some like 12 to 15-hour days. And I remember talking to my team about feeling guilty that I was only working 15 hours a day and not 18 hours a day. And there's a ramp down period, a ramp up, that it's very hard because you do feel like there's so much, and every day you could be working all 24 hours, but that's not humanly sustainable. And I think that's a real issue for responders is how do you actually ramp down on a daily basis, weekly basis, then throughout a marathon like this?
Well, while we're catharsing a little bit, I'll tell you that, so I worry about my wife because I'm gone all day, and she's been at home all day because, she's, staying at home, staying safe. And I come home and we spend a little bit of time together, and then I'm up working, right? And then I'm working till 11 o'clock midnight, and I worry about her because I'm her contact with the outside world to a lot of degree. And
that's right.
And so it's not just what you're saying, but I feel guilty about not working. I also feel guilty about not taking time with my family.
That's right.
And and nobody needs to be feeling sorry for me, but I'm just an example of what we're all dealing with.
Yeah, no, absolutely. And then the flip side is that my wife is now going back with her dental practice. She's actually going back to work. And so now I'm worried about her safety as a healthcare provider going into the mix. So these are very difficult for everyone, an entire community.
So I guess the message here is that for all individuals, people that are involved in this, we really need to figure out the best therapy for ourselves. And that's probably a mixture of some emotional healing and some physical activity.
That's right.
Okay, we have a couple of minutes and I have 7 questions. I just bought a UV sterilizer for my phone. Can I use it to adequately clean my mask?
A new
ultraviolet light sterilizer for the phone?
Sterilizer for the phone.
Okay, the answer to that is y'all don't know.
Okay, next question.
There is some UV. There are some UV strategies for using UV light to actually sterilize masks, but it goes well beyond this. We have no idea what this person is asking.
Yeah, I think
I use it for pain. Modena vaccine, question mark. 45 in Seattle all produce antibodies, neutralizing antibodies for a shortened recovery time. We can tell that our viewers are extremely intelligent.
No, absolutely.
So all the new vaccines have got to go through a rigorous phase of testing, right?
Right.
And so the early numbers on some of these vaccines seem to be encouraging, but really right now they're just looking for safety, not efficacy.
That's right.
So it's way too early.
Safety precautions for kids in summer camps.
Difficult.
Yeah.
Very difficult. Kids are notorious not to listen and not follow those health protocols, so it's very difficult.
What are COVID toes?
COVID toes?
Yeah.
So I know a little bit about this, and this is another one of the bizarre things with this. It's a discoloration of the toes.
Okay.
Yep.
Are stats showing that alcohol abuse is increasing?
Yeah.
Yes.
Anecdotally and
Anecdotally, yeah.
Are GI symptoms now symptoms? Are GI issues now symptoms?
We've said vomiting, diarrhea.
Yeah, vomiting, diarrhea is classic, yep.
Staying inside versus the benefits of vitamin D.
Vitamin D helps a lot, so try to get out, but just to be physically distanced from others.
Yep.
How long would testing centers continue to be open?
At least going through the end of June for our FEMA sites, and we're hoping for longer than that. And before we end, I want to say on a quick note, my kid is graduating from kindergarten today, so woo, 6-year-old, so I'm excited. Celebrate the wins.
So he passed all his tests.
So that's not the end for him, I hope. You've been watching our 10th section of the COVID-19 talk with our local health authorities. I want to express our gratitude to President Kathy Finninger of the Houston Rotary Club of Houston, that is. I should know that. I'm a member. We'll see you next week. I hope this has been informative.
Talk about yourself.